Hi, my name is Mariah. I'm 28 years old. I have been having shortness of breath, fatigue, lots of headaches. I really have not even been able to get out of the bed for the past 2 weeks. I went to the emergency room because the symptoms were that bad. They ran a bunch of blood work on me, EKG, lung x-ray, chest x-ray, and they said that everything was normal. I was completely healthy. I knew what I was feeling, my symptoms, and I knew that I needed some treatment. So I got a little bit tired with what they were telling me, and I went to go see Dr. Raj. After seeing Dr. Raj, he had mentioned to me that, even though they say it's normal, doesn't mean that our symptoms are not, that we don't feel our symptoms, that there could possibly be something inside as far as your hormones being off. And so he educated me a little bit about the hormones, and he told me to run this certain test, asked the doctor to run these certain tests on my thyroid to see where all the levels are at, that our hormones actually affects our body and the way that it works. But for now, as we are waiting for my results back from the lab that he requested, he advised that I get the Myers cocktail through the IV, which is a bunch of vitamins, vitamin C, just a bunch of things to boost the immune system. I got the IV fusion. Was about 15-20 minutes inside the office. After that, I did started feeling like heat all throughout my chest and my lungs for about 20 minutes. But slowly after that, I can really feel like the vitamins working in my body. I was having trouble breathing. I was having trouble getting up. I could not clean the house. I could not cook. I could not get up at all. All I wanted to do was lay down. And that same day, I was able to do more than what I have done in the past 2 weeks. A week later, I got my results back, and he recommended that I take a hormone supplement to get my levels back to where they need to be. There was a certain level with all the thyroid that was low, and he said that he didn't like to see those kind of low levels, so he wanted to put me on a hormone supplement to get my levels back to where they need to be. I've been on the medication for about 5 days or so, and I have not been needing to use my inhaler. Prior to the medication, was using my inhaler every 4 hours. I was also taking Tylenol 2 times a day. And after using this medication for the amount of time that I've been using it, I have not been needing to use anything else, and I'm seeing major improvement. I'm able to breathe more better, clear. I'm not as fatigued, and I've gotten a lot accomplished this week than I have been in the past couple weeks. This treatment is supposed to last for 30 days. After 30 days, I'm to do more blood work to see where my levels are at, if the supplement has increased the levels where they need to be. And so I will definitely keep you guys updated. But if you are having any symptoms with your thyroid, you are feeling any of those things that I mentioned, shortness of breath, fatigue, trouble gaining weight, all of those, then I suggest that you see Dr. Raj and maybe getting your hormones checked out. As he had mentioned that hormones have a lot to do with how your body is functioning.